Welcome to the February meeting of the Pitt County Board of Health. I'd like to open the meeting and see if there are any public comments. Hearing none, we'd like to move on to the minutes of the previous meeting. Those have been circulated previously. Are there any corrections or additions to those minutes? Hearing none, is there a motion to approve?
So move.
Is there a second?
Second.
All right. Any further discussion? All in favor say aye. Aye. Any opposed? All right, the minutes are approved. Move on to the fiscal report.
About January, which is the 7th reporting month period of fiscal year 20. We had a budget amendment of $30,000 to support salaries regarding our centering program. That was through the NC Baby Love program, which brought our total amendments this fiscal year to $175,147. So our total overall budget this year, approved budget, is $11,819,791. Year to date, we are actually looking really good in our Medicaid. There's a slight change in our per member per month. And we're slight behind on our invoicing for some of our private grantors, and that is, they've all been invoiced for January. We just not have received the payment by the end of January. January had a 3 payroll month. We get those once a year, which the employees like, but it doesn't look good on your budget. But all time and items accounted for, encumbered purchases, we year-to-date adjusted, we're at $206,754. We also, I wanted to show you our grants at the end of January. We have $666,394 in grants, and those grants fall outside of the $11.8 million that we were just discussing. And at the balance of January, we still have $258,000, close to $259,000 in grants available.
All right. Does anybody have any questions for Marcia?
Move to approve the budget.
So move. Support. Second. All right. Any further discussion? All in favor say aye. Aye. Any opposed? All right. Thank you very much.
I just want to mention we had 2 resignations in January. We have 13 vacant positions at various stages of advertising. And next month, we will present the budget for you all in our next month meeting. So be ready.
Were any of those clinical positions?
We did, yes, sir. There was one nurse that moved to Virginia, and actually we have two nurse positions.
Okay.
And we have 2 lab positions that we're currently advertising for.
Okay. We certainly hope to get those filled quickly.
Yes, sir.
So. One question I had for you with the transition over to the electronic health record, have we seen any impact financially with billing and collections at this point?
Yes, sir, we have. I feel like some things in Epic go into queues and they automatically go out. Some of them sit in queues and are waiting for maybe the birth of the baby or certain coding. I think Epic is helping us with our walk-in clinic. You can see that our Medicaid dollars are up for January. I think 3 of us went to a coding boot camp that helped. A lot of it was centered around Medicare. We also are looking at a contract with a company called RetroCade. I'm not sure if Dr. Silvernail had a chance to review that yet, but that's a company that comes in and they look through the electronic technology. They look through, so if someone comes in and they don't have Medicaid, but then they come back within a few months and they do have Medicaid, this company catches the data and we can retro bill. So we're hoping that that might be a revenue generator if the contract gets approved.
All right. We were hoping to get some positive after making the investment and getting the extra funds to pay for it, that would start showing some benefits. So.
Yeah, I think the continuity of care for our patients, I think that is a huge benefit of Epic, whereas before we were driving the high-risk pregnancy charts down to the ER on the weekends. Now, you know, it's access. We did have a interesting situation with HIPAA. We have our investigator that goes in for communicable disease was looking at a VIP record in Epic, and it flagged compliance. So there's some things about Epic that there's no way you could track on paper. So, yeah, we're seeing benefits of it.
All right, good.
Sometimes it's pulling your hair out too, but I think so.
Very good. Anyone else have any questions for Marcia? All right, thanks for your report.
Thanks.
All right, looks like we, excuse me, have no old business, so we'll move on to new anybody else have old business to bring up? Okay, new business, Amy Haddam has a couple of items for us.
Trying to get it to expand.
We're just F5, Amy will.
Well, good evening. I'm going to give you a brief report, some updates on some projects that we've been working on for the past several months, actually since last February when we had our strategic planning retreat. And those of you who are new to the board, I'll catch you up to the history of that. First thing I want to talk to you about is a community health needs assessment. We did conduct our needs assessment between 2018 and 2019. During that planning process, we had a Board of Health strategic planning retreat, which was held a year ago. We hired an outside consultant to come and lead that, facilitate that session. And then we were able to share the data collection, primary and secondary data that was collected as part of the process. From that, the board did finalize 4 priority areas to focus on for a 3-year period. And then that report, the final report, was submitted to the state and it was approved in August of 2019. So just a reminder, the health priorities that were selected were chronic disease control, infant mortality prevention, risk factor reduction, which included physical activity, nutrition, tobacco, and substance abuse, many which have an impact on chronic disease control, and then sexually transmitted diseases. We also, there's some partner health priorities that were selected by Pitt Partners for Health, which is administrated through Vidant Medical Center, and then Vidant Health Foundation. They selected chronic disease control, access to care and social determinants of health, mental health, and I do need to note that several of our staff members through public health are serving on committees through this group, so we are working on this collaboratively between the focus areas that the board chose as well as these other entities. So I want to introduce to you the Community Health Improvement Plan. This is our former action plans. This is something that's new as part of the assessment process. In the past, we had these real elaborate action plans that we had created. That has now moved to a Community Health Improvement Plan. It's done a little bit differently, but CHIP contains what will be reported in the annual State of the County Health Report, better known as SOCH. And it does demonstrate progress with response to our county's most compelling health needs that are identified as part of the Community Health Needs Assessment. We were required as part of the new CHIP rollout to go to a results-based accountability training. That was just held in December. And we learned a new way to do the CHIP plan, which was formerly the action plan. So that was a little bit of a delay in rolling out the plans. We completed CHIP just recently, February 3rd, and we submitted it to the state. So we're now awaiting approval from the state to move forward with that. But that's not stopped us from working on the activities that are related to the needs assessment. So these are the CHIP activities that are outlined in the plan. Something's wrong with this microphone. Chronic disease control, we do have a diabetes focus, and that's mainly because we have several resources that are related to diabetes. We have funding for diabetes self-management education program. We also have funding for diabetes prevention program and a minority diabetes prevention program. So all of that collectively, we have a lot going on with diabetes control. And other chronic diseases such as heart disease, cancer, and so forth, we're working collaboratively with the hospital, Pitt Partners for Health, to work in those areas. We also selected diabetes because it is the 7th leading cause of death in Pitt County. And the whole goal of the CHIP activities are to prevent diabetes among individuals who've been diagnosed with having prediabetes or those that have been diagnosed with diabetes. The second one was infant mortality prevention, and the goal there was to prevent babies from dying before their first birthday and to reduce the disparity between white and African American births. And right now, we have an alarming disparity ratio of 3.43, over 3 times the rate African American babies die when compared to Caucasian babies. So the state just rolled out their 2030 objectives to Healthy Carolina 2030, and that is a huge indicator, is infant mortality prevention and focusing on the disparity. So we're right in line with that. The other is tobacco focus. As part of our risk factor reduction, we are focusing on decreasing teen smoking. Rationale behind that, most adults who use tobacco, they begin before the age of 18, and by age 20, they're already addicted. So we have a lot that we're focusing on teen tobacco prevention, and it's through a grant that we do have from the state Tobacco Prevention and Control Program. And then youth who use other tobacco products are more likely to smoke. We're also focusing on other substance abuse. You know, at your last meeting, Diane Carden-Glenn came and presented about the needle exchange program in the community. The health department received over $200,000 to support that initiative in the community. And so we will continue with that, and that will continue to be part of the plan. Sexually transmitted disease prevention. We're really focusing on HIV and chlamydia, and the rationale behind that, Pitt County ranks number 8 with newly diagnosed cases of HIV. With newly diagnosed cases of HIV. So with chlamydia cases, newly diagnosed cases, Pitt County is number 2, and Cumberland County ranked number 1. Can y'all hear me?
Way down.
So we have just hired a new STD prevention coordinator, Deborah Savage. Deborah's here. She was going to say a few words.
Good evening, everyone. I'm the communicable disease health educator. Before taking this role, I was the program coordinator at the Pitt County AIDS Service Organization. I have 12 years experience in that, where we focus more on HIV prevention and community outreach. Do y'all have any questions?
Do you do any coordination with ECU Division of Infectious Diseases?
Adult specialty care.
Adult specialty,
Yes, sir.
okay, very good.
Any others?
Welcome.
Thank you all for the opportunity.
Thank you.
Deborah started with us on December the 16th, and she has already connected us with so many resources in the community that I did not know existed. She's established many new condom distribution sites throughout the community. She's going to be doing a sister-to-sister education program in our STD clinic. She's also going to be doing a Voices, which is video opportunities for condom education and safer sex. I believe that's what that stands for. She'll be doing that in the community. She's getting ready to do some classes in the jail. So she's already in the last couple of months have reached out with some new partners. So very excited to have Deborah aboard. And we're also recruiting for an HIV PrEP coordinator, pre-exposure prophylaxis coordinator, so that we can establish a PrEP clinic in our health department and among 10 other counties. We do have grant funding from the state that is for 11 counties. So those are the activities covered in CHIP for STD. The next thing I want to mention to you is the State of the County Health Report. We are working on that report right now, compiling activities and outcomes information. We're writing the synopsis of various health activities that happen within the health department and among our community partners that will be included in the report. And we're also working with the Office of Public Information for the design of that, so it'll be an attractive report to the community, and we'll distribute it widely throughout the community. That is due the first part of March, and we'd like to come back to the board probably in May and do that presentation, break down each area to let you know what we've been doing in those areas and give you a little bit more statistical information about how we've either progressed or not so much, where our successes. Strategic planning is another area that we're continuing to work on. As you recall, the retreat last February was a kickoff for our strategic planning. It is required through our accreditation process to use a community health needs assessment as a kickoff for that plan. And we have certainly done that. Our management team have been meeting monthly. We did wait for Dr. Silvernail to get aboard with us, have a new director in place before we started planning too heavily. Wanted to make sure that we were receiving his direction. So far, we have conducted 5 strategic planning sessions among each of our divisions, and that would include environmental health, administration, our personal health team, which is all of our outreach, like our social workers and so forth, outreach workers. We've also conducted them on personal health, our clinical staff. That was just this morning. We have had a 2-hour session this morning with them. And then health education and promotion. And WIC Nutrition is scheduled for March the 3rd and March the 10th. We'll have 2 sessions with them. We are conducting, as part of those sessions, a SWOT analysis, which is measuring the strengths, weaknesses, opportunities, and threats, and also asking staff what are the tools that they would need, any kind of resources they would need to do their jobs in the future. And we're collecting a lot of rich feedback from staff. I'm really excited to start pulling this together and narrowing it down into some measurable goals and objectives for the next 5 years. We hope the draft of the results of these groups we'll be able to share in early spring, late spring, early summer, by the time we have it all compiled. So questions about those updates? We'll come back with some more extensive reports in a couple of months.
Yeah, thank you, Amy. Does anybody have any questions for her? A lot of good activity going on. Thank you very much for your updates. All right, let's move on to Health Director's report. Dr. Silvernail.
Thank you, Dr. Ramsey. A couple of quick general things. Attended the Epic Road Show on January 30th to learn about all the new and fantastic things Epic will be able to do in the future for a small additional fee. And last week, Amy and I attended a data sharing workshop sponsored by the North Carolina Department of Information Technology, where we met with some of our partners to look at data sharing needs, both on a day-to-day basis and during an emergency operation. I think it was a productive, most of the day. We were there from 9 to 3, I think it was. The human resource postings, we decided to include that in your packet this month so that you could see the openings for yourself. We did have the nurse resign this month, and we will be reposting for that one. We still have 1 clinic nurse open in addition to that. Communicable disease has been the big news this month. 2019 nCoV, the coronavirus, now given the name COVID-19, has been taking up a large part of my time and some of my staff's time. We've participated in a number of national and state level calls. Right now, I think the disturbing thing is what's called the reproductive number, which means the number of infections you get per each case that you see, and that ranges from 1.5 to 3.5. As of 1,600 hours today, there were 43,146 cases globally, with 1,018 deaths. If you do the math, that calculates a case fatality rate of 2.4%. For reference, influenza is 2.45, generally is what is reported for influenza. If you are unlucky enough to develop pneumonia or respiratory failure with this infection, the case fatality rate rises to 11 to 15%. Individuals with underlying medical problems are more likely to have severe illness. That includes things like diabetes, high blood pressure, heart disease, underlying lung disease, cerebral vascular disease, sort of the usual suspects in that framework. Age also seems to be a unfavorable predictor of outcome in this. There's no evidence of any worse outcomes in pregnant women at this time. There is no vaccine or antiviral therapy available. Treatment is supportive care, and isolation and quarantine are paramount in controlling this infection. And most of you have probably heard of the federal government's handling of incoming folks from China. Influenza activity still remains widespread. We don't want to forget about flu. In spite of COVID-19, the ILI rate right now is about 5%. Not as bad as a couple of years ago where we hit a little over 10%. So I think a pretty typical flu season this year. Across the state, we've had 63 total flu deaths for the season. And at least in our community, we've seen a higher proportion of influenza B for this time of year than we usually do. We usually see that in April and May. But we've seen a fair amount of flu B for this early in the season. Clinical services, our walk-in clinic has been slowly adding services. The volume through that is growing. Revenue from that seems to be growing. The state put out guidance this week for local health department regarding the provision of pre-participation physical exams or sports physicals for high school and other school-age kids. We do plan to add these to our palette of services. Many times a child who wants to play sports can't get in with their regular doctor to get a physical before the end of the season, so we will add that to our palette of services. Maternal child health, I attended Give Kids a Smile last week here in Greenville. Several of our Pitt County Health Department programs were represented at that event. Overall, I think they saw around 100 children for dental services. Was another successful year. WIC, I'm pleased to announce that we received a notification today from CDC that our diabetes prevention program has attained full recognition, and I have that notification here if any of you would like to see that. I'll pass that around. That means that we can participate with Medicare and can bill Medicare for diabetes prevention services given that certification, and that's good for till 2021, I believe, is when it needs to be renewed. Our WIC audit, I mentioned last month, required a corrective action plan. That has also been submitted to the state. Amy mentioned our new STD health educator. We're glad to have Deborah here with us. I've received our consolidated agreement, again tying into the budget that we'll bring before you next month. Our food and lodging supervisor remains open at this time in environmental health. And then I have some information about a new partner, a new public health partner that we've tried to engage with here recently, and that's the local fire service. I spoke at the Pitt County Firefighters Association annual dinner on January 16th, giving them a talk entitled The Fire Service and Public Health, discussing the crossovers between the disciplines. I believe that was well received. Two of our Pitt County commissioners were there at the dinner and got to hear that talk as well. I was invited to speak at Simpson Fire Department for their annual dinner as well, and I spoke on a fire service retrospective, looking at the fire service from the early 1970s through present day. That was January 18th. I've had conversations with State and House Fire Department regarding health services. They're interested in potentially having us provide vaccinations and/or physicals for their members. I will be speaking to them on March 31st regarding fire department occupational health issues. And I met with Fountain Fire Department. They reached out to me regarding fire department physicals, and we'll speak to them on March 9th, a talk called Caring for My Brothers, which is anecdotes from my previous practice in New York State. And that is my report. Happy to take any questions from you all.
Anybody have any questions for Dr. Silvernail? Now, Dr. Silvernail's a previous fire, I guess you're always a firefighter, right?
You can take the boy out of the smoke, but you can't take the smoke out of the boy.
Well, glad to see that you're making some connections down here, so. Okay, is there any other business to discuss tonight? We appreciate the nursing students from ECU coming tonight and seeing how we operate, and hope to see, as Amy mentioned, we have some openings, so some of you that may be graduating, be sure and take a look at us. We appreciate it. Any other business tonight? If not, is there a motion for adjournment?
So move.
Is there a second?
Second.
Any further discussion? All in favor, say aye. Aye. Any opposed? All right, we're adjourned. Thank you very much.